today I have the deep pleasure of having a conversation with the founder of Less Cancer, Bill Couzens. Over the past years, he has become not only a dear friend and colleague, but an R-Band supporter, and I really love the opportunity to work and collaborate with Bill. He is phenomenal, and you're all going to learn today how phenomenal Bill actually is. So, Bill, can you, for the audience, can you introduce yourself and tell them how we met?
Well, I think we were trying to think about this before. I think it might have been, first of all, hello. Hope you're having a beautiful day wherever you are. Here it's wet, snowy, and icy. Um, I think you reached out to me about 5 years ago. And so I, of course, heard your story. Everybody's got a story, right? And I am all about collaboration and bringing perspectives to the National Cancer Prevention Workshop. And your perspective was important to me then and still is, and wanted you to share. So you flew to Washington and you made it happen. You shared your story publicly with members of the House and the Senate and lots of other people, and streamed globally. And today, that workshop, I know last year on Coursera, we have almost 4,000 people that have applied for continuing medical education credits from 10 countries, or a certificate program. It's a combination. They're registered. So it's either for the CMEs or the certificate, which is great.
It's fabulous. So, Bill, a little bit about the
I'm
personal
trying to
side.
say, if people don't know what the continuing medical education credits are, it's for physicians, nurses, and public health professionals. So anybody out there in your world that wants to do this, we would hope that they'd want to jump on board and do it. But go ahead, I didn't mean to interrupt.
No, that's okay. I'll make sure that that link is real easy for people to find. Will we spend just a couple seconds, because you're such a modest guy? Tell us how, I mean, most cancer prevention advocates, it comes from a place of pain maybe, or experience. So obviously you know about Alan passing away from mesothelioma. Share why did you co-found Less Cancer, or not co-found, why did you found Less Cancer?
You're trying to say COVID and co-found at the same time.
Maybe, because you can see my gray hair. Got a lot of that.
No. It's on everybody's mind. It's why we're all talking into our computer screens, right? We all have a story. When I grew up in an area outside Detroit where several of our mothers were sick and passed away on my block. And, you learn about cancer at different stages in your life. It becomes relevant. So as a child, it was relevant to me as a small child. I don't know if I was ever small, but young. And then, as I got older, it was like peeling an onion. First, it was my mom, then it was my sister, then it was my brother, then it was my brother-in-law, then it was my brother. There's a lot of, and people say, wow, you really have a lot of cancer in your family. And it was like, I'm not sure it's in my family, or, it certainly wasn't in our genes. It's not in our genes. It was in our family, but I'm not sure why. Is this the neighborhood? Is this where we live? Is it how we live? Is it because some smoked, some drank, some did both? So who knows? But, at the time in 2003, when my sister died, my journey was about talking to people who would know. I don't know, right? We've often laughed about the fact I'm a C student from Wayne State University, which I'm very proud of, from Detroit, Michigan. I think, let me see if you can see that little flag over my shoulder. But anyway, I started going around to people that really would know and say, can you ever prevent cancer? And they'd be like, yeah. And I didn't understand why it wasn't communicated. So I started communicating about it and asking about it and sharing information. And we had no resources, no big funders. I've always been a person that believes you don't resolve cancer with things that cause cancer. You don't solve cancer with things that cause cancer. So you won't be seeing a tobacco company run a smoking program, or you won't see a soda company running an obesity program. But what we know is that there are many risks for cancer, and in many of these areas, we can tap them down. We can do better. We can lower risk, and we see it from health disparities to things like education and literacy to how we live, what we eat, where we live. Lots of things play a role in it. And what we know, Linda, and you know this too, is now more than ever, we have more cancer than ever before. Not less, more. So
Yeah,
I'm thinking, I'm not very good at my job. Where'd you go? You
I'm
bounced
right
out.
here. Can you
The
see
screen
me?
changed. Yeah, I can see you. It
Oh,
just, their slides up there.
yeah, I
There
was gonna
you
put your mission vision, but I'll embed them later on. Okay,
go.
so you travel on a jet ski, never the Titanic, and that's one of the things I think we have to have our DNA checked because we might have the same DNA. We
Mhm.
think and move similarly. I love the fact that you're so passionate about prevention. When I first started ADAO, I got pushback actually from the community saying we should be investing just in research for for a treatment or a cure. And I always say prevention is part of the cure. And I know you embrace that along with policy. So tell us a little bit about the mission and vision you had in 2003 for less cancer and where you are now.
I will, but you just touched on something I want to respond to, and I know your time is tight, and I appreciate this opportunity. But the tools for prevention are very different than the tools for that we might see in the doctor's office or the hospital. You're not seeing stethoscopes, you're not seeing prescriptions. Sometimes you are, I guess. They're just different tools. So to really secure and guard public health, the things that we work on are things like education and policy and best practices. Now, policy and best practices sounds like a lot of government. It necessarily is not. It isn't always. Sometimes legislation is. But the things that we really get behind, or the things that we attempt to educate policymakers and legislation people, is that we often can help people protect themselves if they can't protect themselves. So, like children, or people who are in working environments where they have no control over what's around them, like Alan did with asbestos. That information isn't out there to the masses. Um, there's several examples of that throughout history, throughout public health history, where people have really done. I'm thinking about that movie, not to be ADD, but to be ADD. The Radium Girls. Have you seen that movie? It's a
No.
check it out. I think you can get it on Netflix or Amazon or something like that. I think Lily Tomlin produced it. It's a really good movie. Check it out. And it really gives you a very good idea of how things can be prevented. But we see it with cigarette smoking all the time. Almost 500,000 people die a year from cigarette smoking. That's crazy.
Right. And we think that about 40,000 Americans die every year of preventable asbestos caused diseases, yet, ding, 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 imports and use continue. You have
Mhm.
an amazing board behind your work, and storytelling is great, but if your story isn't heard, shared, or remembered, you
Right.
kind of miss the beat. And social media helps both you and I tremendously. But there's somebody that on your board who I think is absolutely remarkable, and that's Miles O'Brien.
Mhm.
And he has shared our asbestos story. It was March of 2019, and I know he's an active board member and was personally impacted by a tragedy in his family. But tell us a little bit about how you do your work. We know what your mission is, but the way you move around the halls of Congress and with social media gives people a unique perspective of you and how you do your work, because you don't take any prisoners. You're right out there with the truth. You are a truth teller. And I think your conference on the 4th really demonstrates that. So tell me a little bit about how do you tactily raise awareness and prevention?
Well, it's not even just as much awareness, because we want everything to translate to something more than awareness, right? We really just like people sort of know. Do you really know? Or can we really make change? How can we really make a difference? Because we're not about air kisses. We're really about change. We're not about sound bites. We're not about click-ons. That's not who we are. We're really about change. Not everything happens and I'm not a lobbyist. What I am is a nurturer. I am the person that makes sure people that don't think like me are around the table, in addition to the best and brightest science and medical minds there are. I just don't, I don't pick sides. I don't pick crazy either. We don't really work with crazy, but we work with lots of different kinds of thinkers that have different voices from different political parties and different organizations. And we're about everybody. Because you know what, Linda? And it's why I listen to everybody, I respond to everybody. I do everything I can to meet everybody where they are, because we need everybody around the table. We need to work together. Cancer, I just said in that thing with Miles, or the other day when we were talking on Facebook, there is no divide in cancer, and nor should there be a divide. So we really need to get everybody around the table in behind. How can we lower risk for this kind of suffering? You think of the suffering you and your daughter had, and your husband. Think of that suffering. How can we lower that suffering? Yeah, we want the cure, but nobody walks away with cancer ever unscathed. Everybody's scathed, personally, financially, physically, everybody says. So how can we get together as a society and lower that suffering? How can we tap down that suffering? How can we tap down those incidences of cancer? Because we know with that cancer comes a whole lifetime of cataclysmic problems. And we've all experienced them. The one thing is that as I've gotten older, I've met more people like me and you who have had more losses in their lives. But as we work on less cancer, what I know is it has very little to do with me. I'm just a squeaky wheel on the sidelines, and I encourage people to work together. They may not be like each other. They may not, be from the same church or the same perspective or whatever, but we need to work together to solve these hard problems. And we have too many choices, too much stuff we do without thought, out of convenience or because it's like the next itch. So we're not really paying attention. Like asbestos isn't my problem today until it's my problem. You know what I mean? And I know you've experienced that. I know you must have talked to people that said, oh, I really appreciate what you're doing. And you see them 5 years later when they come back to you with their own asbestos story. That's how it works. Unfortunately, I don't know, I heard the story once where you could tell somebody there's, 52 billion stars in the sky and they'll believe you and quote you. But if you tell them the park bench has wet paint on it, they have to go over and touch it. And it's so much the truth for cancer. And we could be working so much harder to prevent cancer at so many levels. And we need to start early. We need to educate public early on everything from the environment, things like asbestos, to how we eat, how we care for our bodies. It's a journey. So, without people like you, without your work, without your voice, we'd all be lost. And we want more like you. We want more people speaking up and saying, I don't want this happening to my mother, father, husband, wife, sister, daughter, whomever. And those stories are important. Those perspectives are important. I think maybe, when you started with the workshop, it might have been 4 or 5 hours long. Now it's 10 hours long. People they're going to be able to take it over the course of a semester. They're going to be able to take it at their own speed. If they want to focus on your environmental panel run by Miles, they're going to be able to tap into you and find you. It's going to be great. And if they want only that, they can take as little or as much away as they want. We get tens of thousands of viewers during that time, which I'm super excited about. But I'm also really excited about the fact that we get healthcare providers, because what we know is healthcare providers have the education, the science, the medicine behind them to really educate and advocate for communities. So the times that I've spoken at medical schools, it's really been all about advocating for your community. Like, I don't believe it's healthcare unless the word care is in the mix somewhere. And part of that is taking care of people before their patients. We know better. And people with science and medical backgrounds know even more than I know. Not everybody, but they do. They're trained in very specific areas where they can really help secure the public health of their community.
You touched on
So
a really important part, and before we forget, is you look at cancer as a disease that impacts more than just the patient. You know there can be a psychosocial component. The entire family, and you know sadly far too well, it impacted your entire family when your mother and your brother and your sister and your friends. And I think you have such a unique perspective of deep understanding on the painful side that it brings all of that together for your workshop, which I love. Okay, let's talk
let
about.
me say that. Let me say this though. People, I come from a great place of privilege. I've been so honored to have my life. I'm not a rich person. I work hard, 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 but I've had so many opportunities and I'm really blessed, really blessed. And I don't want to raise attention or awareness or anything from any loss that I've experienced. We see people who have horrible living conditions still in this country, really bad, who are at great risk for lots of illnesses. And the one thing that your audience probably knows is that when we work to prevent cancer, we in turn resolve a lot of other issues, which is so critical. And we see that with like diet, obesity, diabetes. That's one place, but we also see it in areas of poverty and access, and it's really a complicated time, and it's tough for people to get health care. So while I've always wanted the cure for people in my family and people that I've loved and lost, I know it's so much worse for others, and my heart breaks for them. And that's really, I said to Miles, if anybody accuses me of being a lobbyist, I'm a lobbyist for those without, and that certainly isn't high paying. And there are too many of those people in this country. There are people with heartbreaking stories. And so there are people who don't know that they're working with asbestos. They don't even know what asbestos is. They don't even know what the risk is. And they blindly are put in a situation where they're trying to support their families. And it makes no sense. It makes no sense that children in Flint, Michigan are drinking water with lead. Or mothers who have two jobs are up at night mixing the formula of their babies with that lead water. I mean, we have to become a more thoughtful society where the focus is on less suffering, less suffering. And we know that when we work for less cancer, we can address many of those issues.
Yeah, I mean, you're spot on. Let's talk about your national cancer prevention workshop, because it is unique. And for people to be able to join you, it is the best dim sum you could ever grab a seat at the table for, because you get lawmakers, you get scientists, you get advocates, and then one of the most important parts, you get students. And they always, at the end of my session, our panel, they always like, how can asbestos still be a problem? It doesn't make any sense. So you bring the next generation, the change makers, to your table, which I adore.
And they'll be joining us virtually too. They, of course, are a big fan of yours, and we hear from lots of them. So it's great. This year sounds daunting because it's an all day, into the night kind of workshop, but it will be edited down. We wanted to live stream it because it's part of what we do. I think that we founded National Cancer Prevention Day because we didn't want a day where we were like, had a bunch of clickbait online and gimmicks. We really wanted a working day, and we wanted workers that are working to lower the risk and not just raise awareness, but doing so many things, like either from policies or legislation, all the things that you do and do well. And so, those are the people and the focus that we want. Of course, you talk about the individuals that make up this day, the scientists, the physicians, the nurses, healthcare providers. We also have a lot of great organizations, medical institutions, and, National Cancer Institute, and experts, really good experts. And I feel super blessed to be able to help facilitate that in my small way, to put it out to the world in a way that's going to make a difference and a change. It's really, for the live feed last year, we had over 30,000 viewers.
In like 10
right?
countries, I think.
No, there are 40 countries from that. And then in the Coursera, it's 10 countries of people that actually get on and register, because I can't really tell how long somebody is engaged. I don't have that full information, and and communicating with some of those places, we're small. We don't have, big guns, big programs, big anything. So, we're small.
Well, you may be small, but you're very mighty. So, for your workshop, I prepared a document that says "No Asbestos," KNOW, and it's
Mhm.
going to talk about
Perfect.
where do you find it in your home, what are
Super.
the early warning symptoms, and what do you need to do to prevent exposure in your home? Because we still have, with climate change, fires, tornadoes, storms, where if a structure was built with asbestos and then it's demolished or needs to be repaired,
Well,
we
and our friend goes out and reports on those fires, and I was like, do it from your windows, rolled up in a car somewhere far away. I wonder about those fires in California,
oh,
what that smoke is.
Oh, well, they're actually, that's why the NIOSH did that study back in, I think it's 2013. They did three cities: San Francisco, Chicago, and Philadelphia, I think. And they determined through the study that firefighters developed cancer at mesothelioma, only one type of asbestos caused cancer, at twice the rate of the rest of the population. So we know that when structures are contaminated, homes, schools, workplaces, or the environment, people get exposed. But I still have a disconnect where people tell me, "Oh, Linda, don't worry about it, it's already been banned." There's a lag, and I think it's convenient, and you know this better than anybody else, that when you produce chemicals and you make money, you might not be the first one to raise your hand at the table that says, "I'm doing some bad things over here, let's get prevention." Right? We know that the chemical industry and others who profit over people are part of the problem. So holding everyone accountable, and you bring lawmakers together, it doesn't matter what party they're from. And
Right.
I love that part of your
And
workshop.
I even I'd rather bring in somebody from a chemical company to be part of the education process, really, not take their money, but be part of the education process, because I believe every human is a good person. I really believe that. Whether it's, we don't always see it in the news, especially. Um, but I believe that people care for others, and that's the premise I'm going with. So I'm not about like busting people. I just want them to be part of the solution, and I like having an inside wheel on some of that without compromising or losing sight of the goals by being so overly empathetic. So no toy should make a kid sick.
Never.
No makeup. Do they still put makeup? But are we still asbestos with makeup? Oh, tell us about that. I want to know right now. Tell me what is going on.
So, because we don't have a ban in the United States, and the EPA regulates like toxic toys and those things, and the FDA does cosmetics and personal care products, because we don't have a ban, a consumer can go to a store and buy Claire's makeup that was made with contaminated asbestos talc, and then the parents don't know. We tested a toy back in 2007, and I cannot tell you how many mothers called me. The toy was marketed, it was a CSI kit, it was marketed during Christmas time. And mothers called me and they were in tears. They said, "I bought this kit for my child, this toy. Now, how do I know if they're going to get sick?" So, part of where I'm going with you, Bill, is to identify what does the communication dialogue look like. If you have been exposed or you might have been exposed, what should you do now? Do you wait 10 to 50 years to, God forbid, get sick? Or can you have a conversation with your physician and says, "I think on this day during these fires, I could have been exposed. Let's have this conversation."
Because your physician doesn't have training in that arena. That's the other thing. There's no training in that arena. And that's what we attempt to do at this workshop. So I think right now, to err on the side of precaution, because we're not physicians, we're not scientists, that it's probably a good idea to do research, even on the things that look so normal, they look part of the landscape of your life, to really check them out. So, for instance, I try super simple stuff. If it's got more than 2 words on it, I try not to buy it. Really, I don't have the time. I don't have the time. And, I know there's some laws out there, but, we have over 80,000 chemicals that we have really no clue as to what's going on. And I am just not of that mindset to pursue all that. So, you know, I try to buy things like apples without other stuff on it, or very simple things that I put together, and try not to bring things in like with fire retardants, you know, no mattresses with fire retardants in them, that kind of thing, where I can. But, you know, listen to me, that kind of privileged perspective, when there's so many people that don't have a choice about sleeping even outdoors, and what would they do for, so that's kind of the injustice of all of this, is that there are people who are in much worse shape that have no choice, they have no option. So your voice and what you do is critical, because hopefully you're reaching those legislators that are concerned about those people too.
Exactly. And with your support for the Alan Reinstein Ban Asbestos Now Act, that was huge to have Less Cancer come on board and recognize a piece of legislation to help stop imports and use and study the legacy of asbestos and also improve chemical reporting. That was huge to have you guys come on board. You know, tonight, in about an hour, there's going to be a local NPR segment in North Carolina, and it's called Asbestos Town. And the journalist reached out to me, and it's what you talk about. It's the health disparities, the social injustice. There's a town in Davidson, North Carolina. uh, they manufactured stuff, right, but commercial grade roofing tiles, etc., with asbestos. Then they walk away from these plants in cities, and it's primarily an African American community now. And these people have so much as raw leftover debris of asbestos. There's actually something called Mystery Hill. EPA came in to mow their lawn in moon suits, in Tyvek moon suits. Yet this community has to go to school, drive past. So I'm working with that town in hopes to, and I'll share your workshop tomorrow when I'm on that panel, and have them key in. If people think that there's hope, like they can reach a Bill or a Linda, and somebody can listen, understand, and process, our stories become a huge piece of momentum to shape policy. So I'm hoping that this community will recognize they're not alone. They have suffered tremendously for over 50 years. It's
So sorry
terrible.
about that.
Yeah, but this segment from NPR is going to be great. And that's what Miles does with your work and many others. So
Mhm.
we need to
And
make sure
yours.
what you're very
Yeah,
sweet. So
so
the end result, why don't you tell people how they can get on? They get CME credit. It's free,
here's
but
the deal. This has
okay.
been super fun to chat with you today. You know, we're rambling. I'm in a deadline, so I am a little bit distracted. We have over 70 participants presenting, over 70 presenters. And it's a long day, it's a long workshop, it's content heavy, it's been vetted, checked, and rechecked. It's all great content, and super proud of it. It's all evidence-based. And we have some great conversations and visitors. So the best thing that people can do that follow you is go to the Less Cancer page and look for the live event on February 4th at 9 a.m. Click on it, stay on it as long as you want, all day. You can be on it all day if you want. Or you can catch up with us on YouTube, where we'll market it through you and other folks that want to share the YouTube links and very specific presentations. Now, I know you have a huge following for people who are very interested in asbestos. We want to make sure they get your information. So we're going to make sure that we have a special effort to get that out to people so they can see it and follow you, because it's great. I've seen it. It's really great. And then what we're going to do is it's going to end up being on Coursera. I don't have the exact date of that. The Continuing Medical Education Department at the School of Medicine at the University of Virginia is who does this for us, and they are amazing. Dr. Balmer, the head of that department, is also our chairwoman, an amazing, smart human and kind. He has a heart the size of the moon, which is, you know, what we need here. And then Andrea Zimmerman, who you've met, our educational engineer, is a rock star. She just not the best, and not only a wizard, but just spiritually so caring about everything about this process. And so we're really grateful to have their guidance and help and direction and support and everything that they do. So 9 o'clock is when people are going to jump on. You can do it all day long. And if anybody out there wants to be in touch with me, they can always email me at billcouzens@lesscancer.org, or they can private message me. And often when they do, I'll send them my phone number if they want to chat with me. And we try to open up a time. And I'm here to talk and listen to them and hear their perspective and hear what they're concerned about. And sometimes we can help. I don't know, sometimes not always, but sometimes we can help and we do what we can. So
Are
that's
you going
about
to
it.
take questions, Bill, during the
Pardon?
day? Are you good? Is there a way to
We're not because it's so
COVID,
it's
COVID?
so intensive. So it's not like a webinar, but if there are opportunities to have this continue. When you register for the program through Coursera, you have to have like an 80% or better on the test to get the certificate. And I'm not sure I could take the test, honestly. I'm really not sure.
Yes, you can.
So even though we put it together, I'm like, God, I don't know if I could do this. And then CMEs too.
You're a rock star, and I absolutely love you. I would come over there and put some red lipstick on your cheek right
Oh,
now. But I want
well,
to say
thank you.
thank you for taking me in under your big less cancer umbrella arm, because you have helped me and ADA accomplish amazing things, and your friendship is so dear to me, and our
Well,
collaboration.
we appreciate it too. And it is, you know, we're all about this. We are all about this. You are going to hear from incredible people from all over the map, with different perspectives, different ideas, great science, great medicine. It's really interesting. And I'm excited that we provide that at no cost to anybody. Now, Coursera, I think, has a registration fee of some sort because of the test and all that, but it's affordable. But the Facebook stuff is always up and it's always free.
You're great. All right, kisses, and I'll see you on the 4th
Please
for
take care.
National Cancer
Thanks for
Prevention
this
Day.
time. I really appreciate you sharing the story. Thank you very much.
All right, early congrats.
Yeah.
Adios.
Bye. Thank you.
Bye, Bill.